Built in 1854, Western State Hospital is one of the oldest hospitals still in use for its intended purpose, caring for those with mental behavioral health needs. We function by our mission statement to be a caring and competent team committed to excellence in behavioral health care. What we mean by this is that we value and utilize evidence-based practices to ensure that those we serve receive the best possible, up-to-date, and appropriate treatment everyone deserves and is treated with compassion. We provide services to the 34 counties making up the Western Kentucky region. We value diversity and integrity as we strive for equality in meeting the needs of all we serve. We utilize and make arrangements to ensure that each patient gets the resources that they need. Patient safety, care, and success after discharge are our priorities. This is accomplished by having a short as necessary hospitalization, providing medication education, monitoring, multiple forms of testing and therapy, all designed to provide those we serve the greatest benefits.
I'm the medical director, and of course I'm over all the physicians. What I see is that Western State continue to take care of severely mentally ill, because those are the people we primarily serve, and of course we serve all kind of diagnosis and everything. And I see Western State will continue to have that role, because we are the one where we get all the referrals for all the challenging and difficult patients which other people cannot handle. I would say Western State is a great place. Over the years, I worked over here, and I've seen people, how everybody embrace the new employees as family, and so this would become your new family away from your family.
So at Western State Hospital, psychology sees every patient who's admitted, and we complete a safety and risk assessment on every person within 24 hours or as close to 24 hours as we can get it. In addition, we assess their overall level of symptoms, substance abuse issues, trauma-related issues, and other psychological factors that might have impact on their treatment, and we report it to the admissions treatment team and then participate in the decision about whether or not the patient needs to stay past their initial court commitment for additional services in the hospital. Once they move out to the rest of the hospital, we try to provide individual therapy, psychological testing as needed, and when COVID conditions permit, group therapy. We also attempt to participate in all the treatment teams and provide consultative services as requested by other team members and physicians. I think the people that I work with are probably the best part, and then the interns and the patients. I really enjoy being around younger people, younger clinicians, especially now that I'm getting older. They keep me on my toes, keep me learning, keep me in an active learning environment. And I like working in a place where the patients really need our help, really need the things that we have to offer. I like working with the dedicated group of people across all different disciplines, degreed or not, who are here because they care about what happens to the people who most need our services.
Our social service department consists of 4 units. We have the admissions unit, we have the acute unit, multi-needs, and the comprehensive support unit. Admissions, they do the assessments. The patients come into Western State. From there, on admissions, if they need longer care, they're transferred over to the acute, multi-needs, or the CSP unit. From there, the patients are placed accordingly to the unit that they need the services. If they need nursing care type services, they are transferred to the multi-needs unit. Short-term care, 30 days or longer, maybe the acute unit, or if they need a little assistance care, they go to the CSP unit. The social worker schedules aftercare appointments for the patients. They refer them for case management services. Any services that we can link them to that will aid in them not returning back to the hospital, and just anything that's going to aid in their continuity care. Expect the unexpected, and it's a very deserving job. It's a very caring job. If you're interested in social work, you got to be patient, understanding, and compassionate.
In the nursing department, I mean, it's pretty exciting. We're first line workers. We get to work with our patients every day, direct patient care. We make sure that their needs are met on a daily basis. For the patients, we make sure that they shower daily. We make sure that we have activities for them. I mean, of course, we pass medications and just make sure that they're taken care of. Their needs are met. Best part of working here would be working with the vulnerable population. I feel like mental health is still underserved, and I just want to be part of making it better.
In therapeutic activities, we conduct clinical sessions on the unit. We have an art studio, a recovery mall, as well as recreational areas and outside areas. As part of the recovery mall, we offer activities for all patients that we have in the hospital. We offer leisure education, leisure activities, fitness education, activities that will develop appropriate coping skills for patients who are going back out into the community, as well as patients who are going into personal care homes. We have to have compassion when we are working with our clients, because they do have mental illnesses. They live with an illness, and help them to understand that they're more than just their illness, that they are a whole person, and that they are loved, and that they have hope. And that we need to be that light in their shadow of darkness.
As chaplain, I get the privilege to address the spiritual needs of both patients here at the hospital and staff members here at the hospital. And then as patient advocate, it's my responsibility to try to address the complaints or concerns that patients might voice. I offer chapel services weekly on the various units or program areas throughout the hospital. I have lots of patients who want to talk with me. They want me to pray with them. They want me to share scripture with them. Oftentimes they ask for reading materials, spiritual reading materials. Most of our patients want Bibles, so I see that they have access to those. If they need other materials, I will do my very best to track those down through other resources that I have. I'm there for patients when if they're in the hospital and they've received word that there's a crisis in their life, they've lost a loved one, and I'm there to help them through that crisis. Also, as chaplain, I help our staff. I've done wedding ceremonies, I've done memorial services, funeral services, and so there's a variety of things that go on, but it's a great privilege to try to help folks when they're struggling with their mental health issues, to be able to be there to offer them some comfort also when they're struggling with spiritual questions they're dealing with in life. Every day we get to do something that, and we may not always realize it, but it makes a difference in someone's life, and that's a huge deal.
Thank you for watching our video.
Along with these departments are several others that make up the Western State family. We hope that in the future you'll be working with us.